Dr. Taranjeet Jolly from Penn State Health's Department of Psychiatry and Behavioral Health joins us now. And Dr. Jolly, what is the mental health impact of this pandemic that you're seeing on children?
Yeah, we are seeing quite a decent or big rise in the number of admissions that we are getting, which are more acute, if we can use that word, meaning that in the past years, while most of our admissions would be kids who have attempted suicide, we are seeing much more severe intensity of suicide attempts now. Kids who are overdosing on such huge amounts of medicine that they have to spend days in ICU, or they were intubated and in a really bad shape, or sustained cardiac arrest. So we have seen a lot of increase in cases like that, and we have been pretty much full. So meaning that at any point in time, there might be like 10, 12, even 15 kids waiting in the ED to get into one of the beds on our unit.
So what kind of signs should parents or teachers look for in kids?
Right. So if you have a kid and not previously diagnosed with any mental health issues, some of the cardinal things to keep in mind would be any sudden change in their energy levels. If you notice, a kid who was normally happy-go-lucky, energetic kid, and all of a sudden they look down and not participating in the physical activities, that would be a key sign. Any change in their appetite, either increase too much or decrease too much, sleep increasing too much, decreasing too much, concentration levels changing. Uh, Keep an eye on if there is any signs of self-harm. Oftentimes teenagers, we see they will cut themselves on their forearm. So if you all of a sudden start noticing the kid is wearing full sleeves shirt all the time and trying to cover their forearms, things of that sort, and just general change in energy levels, or voicing any thoughts of not being around, those would be the key things to look for. Also, see if your kid looks a lot more overwhelmed, on the edge, irritable. Those would be important things to keep in mind.
All right, Dr. Jolly, thank you so much for joining us to talk about this very important issue.
It's my pleasure. Thank you so much.